Later. Repair phase, healing. Follow 48 to 72 hours to about 6 weeks. Remember, there were 3 phases. What was it? Remodel. Well, yeah, think like a house. Okay, so the phase occurs, when this phase occurs, why the area is becoming clean and the removal of cellular debris, erythrocytes, and the clot. Because remember, whenever you have bruising, you have had bleeding. So whenever something is bleeding, it clots just like it's on the outside, it happens on the inside. All right, so tissue repair is accomplished through these 3 phases. 1, resolution. There is little tissue damage and normal restoration. 2, formation of granular tissue occurs if resolution is delayed. And then regeneration is the replacement. We did cover this yesterday. Replacement of the same tissue as it goes through. Continue. Granulation tissue is scar tissue. The proximity of the injury determines the amount of granulation or granular tissue produced. It has 2 types. 1, primary healing, low scar tissue. Healing occurs with the opposing tissues being close together. Secondary is healing the gap of the injury to scar tissue. That's like why we do stitches, right? Yes, we see itty-bitty fine scarring when you have stitches, but if somebody's got a great big crease in their head and they don't get it stitched, then you see where all of that has to be filled in. And so that scarring is much bigger. And then regeneration. Now our remodeling phase overlaps that of the repair. All right, so the first 3 to 6 weeks are characterized by increased production of scar tissue and an increased strength of its fibers. Strength of the scar tissue continues to increase from 3 months to 2 years. So let's talk about like we did an ACL repair. Okay? You're doing a patellar tendon graft. They take the middle part of your kneecap and the middle part of that tibial tuberosity, and they slice down the middle of your patellar tendon. So now, instead of having 1 patellar tendon, you slice it, you actually have 2 patellar tendons, and you're missing that part. It takes up to 2 years for that to fill in. Does that mean that you're not playing for those 2 years? No. But it does mean that for it to get as close back to normal as what it was, it takes that long for it to heal. All tissue of the body can be defined as soft tissue except for bone. That sounds like a great test question. All tissue in the body is soft tissue except for bone. All right? Has 4 types of soft tissue. All right? You have your skin and the lining of the vessels. You have tendons, ligaments, cartilage, fat, blood vessels, and bone. You have muscles. You have brain, spinal cord. Epithelial, connective tissue, muscle tissue, and nervous tissue. Got it? You don't want to talk at all, do you? All right, cartilage healing. Articular cartilage has a limited capacity to heal, and cartilage has very little to no direct blood supply. So if we don't have blood supply, we can't bring in the dump trucks to bring in the stuff to make it to heal. So that's why you have very little healing. Ligament healing. It undergoes the 3 phases of acute repair and remodeling. And full ligament healing with scar maturation may take as long as a 12-month period. Now there is an exception, isn't there? What are those 2 ligaments that are your exception? There's one, ACL, and your PCL. Because they have what? Very little blood supply. Exactly. So with very little blood supply, they have a tough time healing. Skeletal muscle healing repairs on the same pattern as the 3 phases, but must have rehabilitation, strengthening exercises, and in a progressive manner. So, nerve healing. Nerve cells do not regenerate. So that means you know that because if somebody becomes a quadriplegic or a paraplegic, they don't regenerate, so they can't heal. And if they can't heal, they're that way forever. So regeneration can take place, regeneration can take place within the nerve fiber, and obviously the closer the injury is to the nerve cell, the more difficult regeneration becomes. So soft tissue healing. You're not liking this. You guys are like, mum's the word, huh? It is a lot. You got warmth, now you're tired. Modifying soft tissue healing. Healing process is unique in each athlete. So what might work for him might not work for him. So, and that's why when your coach comes up and says, how long is this ankle going to take? How long is this hamstring going to take? You can't go and say, she's going to be the same length as what she is. It just doesn't work. Okay? So it's different for each athlete, it's different for each tissue, and the tissue varies in the ability to heal as well. So, for example, cartilage. Age and nutrition may also affect healing, and also health conditions may affect healing. Nutrition, obviously, if you've got somebody over here who's eating right, somebody over here who's barely getting enough nutrition to make it through the day, this one here is going to heal quicker than the other athlete. So one of the reasons why we have these little shakes. What you have? Carbs, you have proteins, you have fats. Which one rebuilds tissue? Proteins. Management. Drugs to treat inflammation, used to decrease vasodilation. You have therapeutic modalities, which is anything that promotes healing. It could be something as simple as a bag of ice, something as simple as your hand with massage, all the way to the lasers, the stem, the exercise machines, ultrasounds, TENS unit. And then you have therapeutic exercise. And the focus is on soft tissue rehab through exercise in a pain-free movement. Full strength and power and full extensibility of muscles. The focus on the ligament is pain-free again and full strength and range of motion. And immobilization is not always good for injuries. Back in the day, 30, 40 years ago, somebody would get an MCL sprain, and let's say they did a grade 3 MCL. If you got an isolated grade 3 MCL, how many of those do you see have surgery today? 0. Essentially 0. All right? We know that they will finally heal together. Okay? But way back in the day with a grade 3 MCL or even a grade 2 MCL, they would take them and they would put them in a full leg cast. A cast from their hip down to their toes. That immobilization really hindered everything that needed to be done. That athlete's losing range of motion. His muscles are also going to have atrophy and contracture. So therapeutic exercise is a whole lot better than immobilization most of the time. All right, fracture healing. What are we on? We're on what? 14 of 19. We got so much time to go. So, acute fractures of the bone follow the same 3 phases again. In general, though, acute fractures healing has 5 stages. Hematoma formation, cellular proliferation, callus formation, ossification, and then remodeling. The ossification is actually laying down the calcium, and then it remodels back to what it used to look like, or a similar variation of what it looks like. But if you break like your collarbone, it's not going to look. It's more than likely it will never look exactly the same. You usually get a great big lump. It doesn't reform. Huh? You don't have the big lump? Was it a fracture? Well, separation is not a fracture. So, hematoma formation, you have an acute inflammation that lasts about 4 days. Hematoma forms around the ends of the bone, and a blood clot forms. What's on the inside of the bone? Bone marrow. All right, and that is super important in blood cells, right?
Hemoglobin. I just talked about that last night.
Here we go. Cellular formation. The hematoma begins organization of the granular tissue and gradually builds a fibrous junction between the fractured ends. These cells initially produce a fibrous callus, then cartilage, and finally is woven into bone. Now think about this. There actually have been studies over in Europe where you would fracture both of your legs. And once you would get to cellular formation, they would have external fixators, which would hold the bone in place, that they would just increase it a 1/16 of an inch. They're trying to make the bone longer. Have a fracture, as it starts to heal, gets to a healing point, then they pull it apart. And they pull it apart. Every time it got to where it sounds very painful. It sounds crazy. Callus formation. The soft tissue is formed within 1 to 2 weeks, but in an unorganized network of woven bone at the ends of the fracture site, and later absorbed and replaced by bone. 2. At this stage, the internal external callus are produced. These calluses are to immobilize the fracture site. 3 and 4, hard callus starts to form. Hard callus continues to grow from months 3 to 4. And then the hard callus's gradual connection to the bone filament and woven into the bone and fracture ends. So we had the one kid last year that broke his arm, right? Yeah. But it took him forever to get that part done.
Okay.
So, anyways. So, it goes back to not everybody's the same. But there's your dealing. Huh? All right, we'll talk about D and E manana.